Hello dear friends, welcome to KAPS Recalls discussion. Let's start with question number 91. Which of the following is a nicotinic receptor agonist used in smoking cessation? The options are bupropion, varenicline, fluoxetine, venlafaxine. So here the correct answer is option B, that is varenicline. Bupropion, it is a norepinephrine dopamine reuptake inhibitor, and varenicline, a nicotinic receptor agonist, are agents used to assist in smoking cessation. Nicotinic receptor partial agonists may help people to stop smoking by a combination of maintaining moderate levels of dopamine to counteract withdrawal symptoms, that acting as an agonist, and reducing smoking satisfaction, acting as an antagonist. The most widely available treatment in this drug type is varenicline, which is available worldwide as an aid for quitting smoking. Next question. The cation most prevalent in the extracellular fluid of the human body is. The options are potassium, chloride, phosphate, sodium. So here the correct answer is option D, that is sodium. The relative concentration of different anions and cations varies considerably between intracellular and extracellular fluids of the human body. So the intracellular fluids contain high concentrations of potassium, which is the cation, and a phosphate, an anion. Whereas the extracellular fluid contains high concentration of sodium, which is a cation, and chloride, which is an anion. Next question. A child who swallows an overdose of a fluoride containing product should be treated with a gastric lavage containing. So in the question they have asked about the antidote for fluoride toxicity. So here the options are EDTA, that is ethylene diamine tetraacetic acid, sodium chloride, castor oil, calcium hydroxide solution. So here the correct answer is option D, that is calcium hydroxide solution. Acute fluoride ingestion is generally treated by using a gastric lavage containing dilute calcium hydroxide solution. The calcium reacts with the unabsorbed fluoride and prevents its absorption. It also prevents the development of hypocalcemia in the patient. Question number 94. The blood concentration of which of the following cations would normally rise if a patient became hypophosphatemic? Hypophosphatemic means low levels of phosphate in the body. The options are phosphorus, magnesium, calcium, iron. So here the correct answer is option C, that is calcium. There is always a reciprocal relationship between the concentration of calcium and phosphorus in the blood. For example, hypoparathyroidism is characterized by low serum calcium and high serum phosphorus, whereas hyperparathyroidism is characterized by low serum phosphorus and high serum calcium. So always keep in mind that there is always a reciprocal relationship between the concentration of calcium and phosphorus in the blood. Next question. A drug indicated for the treatment of both diarrhea and constipation is. The options are bisacodyl, lactulose, polycarbophil, senna. So here the correct answer is option C, that is polycarbophil. This polycarbophil is a synthetic hydrophilic compound that is capable of absorbing large amounts of water. It is indicated for use as a bulk laxative in the treatment of constipation. It is also employed in the treatment of diarrhea, in which it absorbs excess free fecal water and helps create formed stools. So with this question we have completed today's recalls discussion. Thank you for watching this video. Let's see in the coming video session.